Welcome to today's Wavy Digital Chat about smoking in the casino. We have Dr. Marchigiani with us from Sentara. He's a thoracic surgeon, so I'm going to bring him on. Thank you so much for being with us. This has been a big topic since the casino opened on Monday. We've had a lot of comments on posts. We've had a poll that has had a lot of reactions in terms of who wants to go to the casino because of the indoor smoking policy. So we really appreciate you being here and diving into this topic.
Yeah, thanks for having me. I appreciate it.
Well, first, just for the viewers out there, could you give us a little background about your field and what you do as a thoracic surgeon?
Sure. So I am a board certified cardiothoracic surgeon, but I specialize in general thoracic surgery. So majority of what my practice does here at the Sentara Cancer Center is a lot of lung cancer, esophageal cancer. We also treat chest wall injuries, rib fractures, benign malignant esophageal and lung, as well as mediastinum. So primarily I'm operating in the chest the majority of my days. And now I've been here for about 6 years at Sentara.
And, one of the questions that I just want to start with is what was your first reaction to hearing that indoor smoking was allowed in the casino?
Um, Somewhat surprised, shocked, somewhat appalling, to be completely honest with you. Nowadays, with most, if not majority of places indoor being non-smoking, to hear that we're allowing smoking in such a large venue with so many people inside was just not something I wanted to be hearing for sure for the population.
And, you know, I guess when you hear of, smoking in terms of your field, how many people do you treat that has been a part of their history?
Um, I would say a majority of what my practice is lung cancer. And maybe 10 to 15 years ago, we were seeing primarily smokers for lung cancer, 95%, I would say, on average. Over the last 5 to 10 years, particularly in my 6 years of doing this, we have noticed an uptick of non-smokers coming in. So we're thinking it's roughly 80 to 85% smokers, and now going from 5% to 10 to 15% non-smokers, it's obviously a concern. And I think the reason we're seeing that is we're seeing an age group that grew up in the era where smoking was allowed indoors. It was commonplace in restaurants, in the houses, in cars, and a lot of those non-smokers are now presenting with cancer from the secondhand they had when they were growing up as children, and now they're adults in their 50s and 60s, and we're seeing an uptick of non-smokers who are coming in with lung cancer. So I would like to say that historically it was primarily smokers who were coming in with lung cancer, and head and neck cancers for that matter, for head and neck surgeons. But I do think we're seeing an increased population of non-smokers because of secondhand smoke. So when you hear things like indoor smoking in venues like that, it of course is going to kind of not sit well when you see those statistics and see so many non-smokers now having lung cancer.
And then, you've also mentioned secondhand smoke and then third hand smoke you mentioned for indoors. Can
Yeah.
you explain what that means?
Yeah, so firsthand smoke, we know you're smoking, you're inhaling it. It's pretty self-explanatory. Even secondhand smoke, it's very commonly known that if you're next to someone who's smoking, you're getting that poor quality air secondhand, and you're being exposed to all the detriments of smoking that the person who's actually doing the smoking is getting. However, one thing we overlook very commonly is what's called third-hand smoking, or third-hand exposure, and that has been studied to a certain extent with air quality. But one of the other reasons we know about third hand is particularly in patients with asbestos exposure from the shipyards, when those clothes would be brought home from work, and then someone who's washing those clothes are getting the asbestos fibers from the clothes into their lungs third hand off the clothes. And it's the same idea with smoking. When you smoke inside a building, it's getting on clothes. You're going home with those clothes. Someone else is cleaning those clothes or inhaling on those clothes, and you're getting the same, similar, maybe not to the same concentration, but the same extent of damage can ensue over long periods of time. And when you talk about inside of a building, the nicotine, the carcinogens, the smoke gets embedded into carpets, gets embedded into walls, wallpaper, paint. It starts to affect the air conditioning units, the ventilation units. It gets on machines and tables. And the longer you smoke inside, the more it gets embedded into those surfaces and the harder it becomes to clean. So ultimately, if you go into a house that someone smoked in, the only thing you can really do is replace carpets, replace walls, replace furniture, and it gets costly. And so if you're going to be smoking inside a venue like that, you can imagine over the time that people smoke in there, the amount of smoke that's exposed, it's just getting embedded into the walls, the tables, the carpets, the chairs, etc. And it's going to be fairly costly one day if they do want to go non-smoking to replace all of that.
Right. And it
So
is,
yeah,
24/7,
yeah,
365 days a year. So
yeah.
there's no break to that
No,
smoke.
no break. So
Mhm.
first hand, second hand, third hand, it all plays a role. No one's safe when you're in a building like that, and it's just, encompassed by smoke.
Um, and then I did want to also speak to, I think when people say smoking, maybe the first thing they imagine is cigarettes, but there are other things to smoke, whether it's marijuana, whether it's vapes, whether it's cigars, and that is all, um, you know, prevalent in certain places. I mean, I know that for one of our team members, they've seen cigars on the floor.
Mhm.
There's been comments of
Sure.
other things, but can you just speak to sort of the other things out there besides cigarettes and the effects of that?
Sure. Yeah, I think some things are currently getting studied and looked
Hmm.
at. The kind of the side effects. We know smoking, and we know cigars, and we know cigars aren't a safe alternative. Some people say they don't inhale, and that's fair. If you're not inhaling, then you can somewhat say you're not exposing your lungs to that, or your airways to the heat. But then there's the alternative to, mouth cancers and things like that. With marijuana, there's somewhat of a gray area. A lot of times I'll tell patients, if you don't know where you're getting your marijuana from, you don't know what's in it, you don't know what else you're putting into your body. So there's a factor of an unknown there. And then I get the pushback, well, I'm growing my own, and so it's probably safe. And although that could be true, and you may be trying to smoke as natural as possible, you're still putting something into your lungs that was really truly never meant to be there. And not only what's going into the lungs, but the heat coming off the vape when you're heating the element. The heating element itself is heating up the air, or the vape, which is being brought into the airways, into the lungs. Those hot gases that you're bringing into the lungs are doing damage to not only the lungs themselves, but those little hairs on the inside of your airways, which help promote secretions and help cough up things, those are getting damaged and they don't work any longer. And when you do that over time, they tend not to grow back very quickly, and you increase your risk of pneumonia. So even if you're doing things like vaping, cigars, marijuana, cigarettes, they all have detrimental effects, not only to the way the lungs function and the way the airways function, but ultimately to the lung tissue, the ability for the lung to diffuse oxygen, the ability for the lung to become elastic for longer periods of time and help you breathe. There really isn't a safe alternative. The only thing we should be breathing is the fresh air outside and the air we have inside that theoretically should be, non-smoking. And although we have plenty of pollution in the air, if we can do whatever we can to prevent being exposed to other things directly, we should be doing that.
And we hear some people say, I'll go visit once, or I'll visit a few times, or I'll only be in there for an hour. Is there a line that you can cross of, moderation where, a cigarette or another type of smoke can affect you? Or is it really just, you want to decrease your smoking environment as much as possible?
Yeah. I mean, of course, everything in moderation. I mean, as a non-smoker myself, I'll be very frank that I probably won't step foot in a place that has indoor smoking. I don't want to expose myself to that. I don't want to expose my family to that. It's just a personal preference of mine. I mean, sure, if you go once or twice, is it the end of the world? No, it's probably not. But repeated exposures, particularly to secondhand and even third-hand smoking, even if you're a never smoker or a non-smoker, um, over time it will accumulate. And I can't say that you're going to have detrimental effects from going only a few times, but we should just avoid it at all costs if we can. And if I'm going to be bold and say this, I think that there at minimum should be a non-smoking section so people can go and enjoy the casino in a safer way. And for those who don't want to be exposed to it, I even know smokers who don't want to be exposed to secondhand smoke. They rather go outside and smoke and come into fresher air. And I think I'll be bold and say it, that there should be a non-smoking section, a safe way to do that, a non-smoking section
Mhm.
at minimum.
Right. And right now, the casino floor is all smoking.
Right,
So if you are in there, you can't, I mean, you could go to the restaurants, and I think,
right,
that's not a lot in there, but, to actually
right.
partake in the activities, partake in the bars and all of that, that area within the casino floor, is
Yeah,
smoking.
yeah.
And then if the secondhand and third hand smoke, that's interesting because obviously it does stay on your clothes when you're going into those
Hmm.
restaurants, you're going
Hmm.
into those hallways. So it doesn't just leave you as soon as you leave the casino floor.
Correct. I mean, and that's the thing. Even when you can't smell it or see it, it can still be there. And we talk a lot about children being around smoke in cars and homes. Even though you don't necessarily see it or smell it, it gets deposited on the tables and the furniture. And especially for a kid who puts their hands in their mouth after touching a couch or a table, I mean, those are the risks. It's as simple as that. You can't always see the risks. The third hand, particularly, you can't always see it. You can't always feel it or touch it, but it exists. And so I don't know the way the casino's laid out. I have not been there. I understand the restaurants are non-smoking, and I think even the concert venue that they have there is non-smoking. I don't know how those areas are separated. Hopefully, it is completely separate, so you can at least go to those areas and not be involved in it. But it is relatively unfortunate to hear that they're allowing that inside.
Right. And then the one thing I did want to say is I think a lot of us are thinking of, people that are going to participate, people that are going for fun for a few hours, but
Hmm.
the employees really are going to have to be there in that environment for their shifts, right? And
Yeah,
or for days and back to back, for
yeah,
weeks and months. And so, the effect of that, even if they're not smoking secondhand, even might wearing a mask, I mean,
yeah,
that's pretty bad for the employees based on what you're saying for your
yeah.
advice.
Yeah, I mean, the employees, it's definitely a life decision that they're making to work in a place like that, especially long term. They're putting themselves at risks, especially for people who are non-smokers, never smokers, and really don't want to be exposed to that. And I wish I could say that masks were going to make a difference, but ultimately, the fumes from the smoking are going to penetrate the masks ultimately, unless you're wearing an entire respirator, which I'm guessing most people are not doing. If any, you're not going to be free from that. And then what happens is the mask gets saturated, and by the end of the night or the end of the shift, you're basically smelling it off your mask, which is third hand. So there really isn't a good way to get around it, whether you're wearing one mask, two masks, and N95. The smoke is still going to find a way around that over time, and it's going to get saturated and just smell like it.
And then, the one thing I did want to ask too, in terms of, when you're leaving, when you have smoke on you, I mean, those people that are not smoking, the secondhand smoke, I just want to go back to that because
Yeah,
I mentioned a little bit, there might be an air filter in the building that works, there might be certain things to try to mitigate that, but secondhand smoke, in any part of your life really is dangerous and can just as easily, from my understanding, lead to sort of possible cancer or things depending on your level of secondhand smoke.
correct. Um, the exact amount that you'd have to be exposed to is not something that we would have answers
Hmm.
to. I would say the more you're exposed to it, the more your risk goes up. And like I said, I've had patients who are never smokers and are coming in with lung cancer. And typically the story is that they had parents who smoked around them in the house and in the cars and in the restaurants. I do have some people who come in who were never exposed to it too, and there's also a level of genetic for some lung cancers, and so I can't say that smoking is always 100% of it, as we know that genetics plays a role. But the majority of patients that I see have had first and secondhand exposure, and likely third.
And then the next category of people I just wanted to mention also is, there are people that have asthma, that have respiratory problems, that, really are going to have trouble, not just going to the casino, but going to any environment where like they might put themselves at risk. I mean, can you just talk about, even if you have asthma or trouble breathing, those are definitely concerns for people as well, besides cancer, just
Yeah,
developing certain other, issues.
right. 100% agree. I think any other comorbidity with breathing, whether it's interstitial lung disease, whether it's asthma, whether it's bronchitis, they're all going to be exacerbated by the exposure of noxious stimuli. So whether that is an allergen in the air, or whether it's smoking, whether it's radon or some kind of pollution, they're going to exacerbate the current condition. And one of the things I tell all my patients is after surgery, I don't want you going to a smoking environment. Even if you're a non-smoker, I don't want you to be in a smoking environment, because after surgery, where I'm removing part of your lung, that is going to make your recovery harder. It's going to potentially increase your cough, increase your pain, increase your risk of pneumonia. And I even tell the spouses, if the spouses are smoking, then my patient's going home to a house where the spouse is smoking, I tell them they cannot be smoking around the patient. It's just like you said, it's a noxious stimuli that's going to increase the risk of any complications post-operatively, just like it's going to increase the risk of someone with underlying lung disease. Not to mention the cardiovascular effects that smoking has. We won't even go to that today, but blood vessels of the body are affected by smoking, in the heart and the legs and the neck. I mean, you name it. It's a systemic disease. It really is.
And I mean, people must come to you that are smokers, and then, they end up developing, certain conditions or cancer. I mean, is there advice that you give them or their families or their children, to not get involved in that? I mean, I know that especially in younger kids now, jewels and vapes and those sorts of things have
Mhm.
become a trend, and have
Right,
become a
right.
thing. But what are some of the things that you tell them?
Yeah, I tell, so particularly someone who's going to be having surgery, they do have to be off all smoking related activities, whether it be marijuana, um, vaping, cigarettes. They have to be off all smoking related activities for at least 4 weeks before surgery. And usually when there's loved ones in the room, they're hearing the same conversation I'm having with the patient. So there's no secret to what I'm saying. Um, it's not that I only tell this to people who are smokers. I repeat this to even non-smokers, that these are risks you need to know and you can share with your friends. So all smoking activities have to be stopped 4 weeks before surgery, and the hope is that they don't return to them following surgery. Obviously, I have no control over that, besides telling them the facts. But that's the conversation I typically have. There's no safe alternative as far as smoking is concerned. If you want to do gummies and chews and things, that's your prerogative. But for surgery in particular, we don't allow any type of smoking before surgery, no matter what it is.
Um, I mean, that makes sense, and that's really interesting. Just because, as you talked about too, it's the heat, it's the smoke.
Hmm.
All of those are potential factors.
Right. Increase the risk.
I think that answers a lot of my questions. I'm just looking through the chat. If you see me looking this way, just to make sure that
Sure.
none of our viewers have any questions. I think just as much as posts on Facebook, this topic in both directions has a lot of comments.
Sure. Sure.
And I think people are concerned with a variety of things. And if they're not worried about smoking exactly, they're worried about the smell of smoke, because
Mhm.
that obviously does linger. And that makes
Right.
sense with your third hand smoke comment, that it does last on you.
Right.
Whether
Right.
you're concerned about the actual, fragrance and smell of it, or if you're
Absolutely.
worried about the effects of it.
Absolutely. Yeah. I would agree with that. And I again, it's not about being judgy. I mean, we all have habits that we want to kick, and we all have things that we know aren't good for us. And I'm not pretending to be a perfect angel by any means. We all have our things. But unfortunately, with my job, I just see the dark side of smoking and vaping and other sources. And I just think that we've come so far as I'm concerned with smoking, and now allowing it indoors and trying to restrict to the secondhand, and then to see this happen, it's just kind of surprising, to be honest with you. But again, it's not that we're passing judgment on anyone. I just think that if we're looking at what's best for everyone, the best thing would be to not have the smoking indoors and have dedicated smoking places where they can go and do what they need to do and then come back in and continue enjoying the casino. I mean, that to me would make the most sense.
I mean, and that's, we'll get into, hopefully, at some point there'll be more information on the policy and, economics of all of it. I know that people make those decisions. But yeah, I mean, I think, and I told you 70,000 people voted on our, 7,000 people voted on our poll. And it's really been 80-20. So of people not wanting to go to the casino because of the smoke. And, I don't know what the pool is and who's voting on that, but between all of our comments, this certainly has been a big topic for everyone, and we'll end up seeing, who goes to the casino or not. But I mean, I'll leave the floor to you if you have anything else that, you want to share. I mean, I'm sure you could dive into a lot of areas of this topic for hours. So
I would just say that, we have a lot of support where we are here at the Brock Cancer Center for Sentara. I mean, we have pulmonologists and nurse navigators and nurses in our office and ancillary staff and the physicians. And we have people that can help for those who really do want to truly quit and try to kick the habit. I mean, there are so many options to help you with that. All you have to do is reach out to us and we can get you plugged in with someone who can help you with that. We don't pretend that it's easy. I know it's hard. People have been smoking for long periods of time, and a lot of them will quit before surgery, and they're able to do it. So I know it's hard. I'm not sitting here passing judgment and saying it's not. It's a difficult thing to do, but we have the proper avenues to help people out. So if anyone is listening and they have been thinking about it and they really want to try, I recommend you reach out to your PCP or your pulmonologist or even our office, and we can get you the help you need.
Well, thank you, Dr. Marchigiani. I really appreciate it, and you giving the time to talk about this topic. And I'm sure the debate and the conversation is going to continue, but hopefully people can tune back into this if they just want a little bit more intel on what smoking in the casino could mean for them.
Absolutely. Well, thanks for having me. I appreciate it.
Thank you so much. And thank you to everyone that's joined in on the chat. This will stay up on Facebook, and this will be up on YouTube and thewavy.com, so you can tune into the conversation anytime. Thanks so much.